Dr. Tedros Adhanom Ghebreyesus has held cabinet positions in the Ethiopian government since 2005, firstly as Minister of Health and most recently as Minister of Foreign Affairs. Unlike the other candidates, Dr. Tedros' career started out in science rather than medicine. A biologist, he received his PhD in community health in 2000. His work has been international, with stints chairing the Executive Council of the African Union and the Vaccine Alliance Gavi. At the WHO, Dr. Tedros led the Rollback Malaria Partnership and co-chaired the Partnership for Maternal, Newborn and Child Health. His application was submitted by the Ethiopian government. Dr. Tedros, if I could begin by asking you what you consider to be the main challenges for global health.
I believe that there are four major challenges. One is inequitable access to the essential health services. I think that's very central. And the second is, we're very vulnerable now to emergencies. The world is globalized, getting smaller and smaller. So an outbreak somewhere becomes an outbreak everywhere. And the third challenge is gender inequity. And then the fourth challenge is that comes from climate change and also environmental change, its impact on health. So these are the four major challenges we need to really confront, but the central part being the inequity to access to essential health services. And that's why I say universal health coverage or health for all is the center of gravity. And I believe that all roads should lead to universal health coverage.
Thank you very much, Dr. Tedros, for being with us on behalf of the Global Health Center at the Graduate Institute of Geneva. So the challenges that you were just mentioning are certainly major challenges facing the world. What are the big challenges facing WHO in helping the world to address them, and why are you the person to lead WHO in doing so?
I think the major challenges for WHO are, as I believe, one is WHO is underfunded, and the funds it gets is not flexible. And the second challenge for WHO is it's overstretched. It tries to be everywhere and maybe ends up being nowhere. Mm-hmm. And the third challenge that I understand is the weakness in predicting and also responding to epidemics swiftly. And the fourth is especially the lack of expertise or talented people, unless the inside of WHO, the internal situation, is really strong and the staff is ready to fight. I don't think we can make a difference. So these are the four challenges for the WHO as I can understand them. I was born in this environment in Ethiopia. We are communicating virtually, so I'm still in Ethiopia when I'm talking to you. And Ethiopia, like many other developing countries, Africa and many other developing countries, is overburdened by health. By the way, when I was a child, and when I was only 7 years old, I lost my own brother, younger brother. From what my parents tell me now, maybe he had died because of whooping cough or measles. I cannot tell which. This child could have been saved. And that's why I say I have the passion. And the second, which is the experience, as health minister and as public officer, deployed in many fights and also experiences. I have the first-hand experience to fight all the ill health in our country. Not only that, I reformed our health system based on the WHO guideline, by the way, reformed the service delivery, workforce, health information, health financing, emergency preparedness, access to drugs, you name it. A very comprehensive reform.
Let's delve into one of the issues that you mentioned as a major challenge for WHO, which is funding. How would you apply your skills to changing the situation? Last October, there was a dialogue where the DG asked member states to increase their assessed contributions to WHO, and member states basically did not reach agreement to do that. How would you convince member states to give WHO the funding that you think it needs?
I will do, first of all, I will start by really using whatever funds we have as wisely as possible. In Ethiopia, that's what we did, by the way. The first step in Ethiopia was, before even going to partners to give us more money, we have tried to show them how we can create value for money. And the second would be, the second step I would take, then to candidly discuss with the member states. As you know, 16 years ago, the assessed contribution was 49% of the total budget. And now, the percent of the assessed contribution is only 20%. Mm-hmm. And I will talk to the member states candidly saying, this is really wrong. Because with 20%, the member states themselves cannot really claim ownership of WHO. They cannot. Because for a simple business, what do you call it, principle, any organization, unless you have a 51% share, I don't think you can have a majority share.
Another question before turning it over to Fiona, which is on the issue of emergencies. WHO has been severely criticized for its response to Ebola, and this has triggered a series of reforms, including the operational capacity I mentioned earlier. In your view, are these reforms adequate? Is WHO in better shape today, or does it remain weak in its ability to respond to emergencies?
One thing I have to really commend the current management is the emergency response program that was endorsed last May 2016. I was there actually campaigning for my DG. It's really good enough. And we have the international health regulation also. We have to implement both. We have to focus on implementation. We have to get things done. One, I think we need to focus on country capacity. That's very important, and number one. And number two, WHO should continue, based on the reform, to strengthen its own internal capacity. And the third is focus on getting predictable financing. We have to work day and night to have the predictable and sustainable finance for the emergency.
I wanted to ask you about human rights and transparency. We noted that in the analysis published in The Lancet last week by Kent Booz, of the 6 candidates' platforms, yours was the one where an absence of comment about human rights was noted. In view of concerns around human rights in Ethiopia, do you think this should be a consideration for member states when considering your candidacy?
I believe countries will not consider this because they understand one thing. They understand two things actually. One, our democracy is nascent. Everybody understands that. And in a nascent democracy, you will expect lots of challenges compared to those who have a mature democracy. But you should know that even those who claim to have a mature democracy screw up. And nobody actually can claim that they have a perfect one. So they know that. That's a nascent democracy. And second, democracy or human rights is a process. It cannot be achieved overnight. And the other thing I would like to assure you is that member states will also check our commitment to democracy. As a member of this government and as a foreign minister just until 8 weeks ago, our commitment to democracy and human rights is very strong.
Questions have been raised about Ethiopia's handling of grants from the Global Fund for Fighting HIV/AIDS, TB and Malaria. Indeed, there was an investigation by the Inspector General and an audit of the grants handling in 2015. As a former chair of the Global Fund Board, could you give us a comment on that?
By the way, to correct, it was not investigation, it was a regular audit, okay, like any other country. And Global Fund came and audited for 7 years, the 7 years performance. And by and large, the performance result was good. And not only that, immediately after the audit, we got a lot of money. The Global Fund never complained about any problem with the audit. So I'm not the right person to ask. It's better to ask the Global Fund. But as far as I know, it's clean. And that's why Global Fund actually continued to finance.
You mentioned earlier that you support more transparency at WHO. The Global Fund has a transparency policy, and the WHO does not yet have one. If you were elected Director General, would you create a transparency policy? And why do you think that WHO has not yet implemented one?
By the way, as far as I know, in relative terms, WHO still is in a better position in terms of transparency. There are some things that Dr. Margaret Chan already had done. I would build on that. I'm not saying there is no transparency. There is. And it's even better related to some UN agencies. We can build on it. And if there is the best transparency policy of one institution, UN institution, or it could be even Global Fund, we need to benchmark that best practice and take the level WHO has now to that higher level. We don't need even to reinvent the wheel. We can just learn from them, that best practice, benchmark it and implement it.
Dr. Tedros, many thanks indeed for joining us.
Thank you very much. Thank you for having me.